Pain and fever medicines are the most loved and the most abused products in every pharmacy. People take them for headache, body pain, flu, periods, toothache, even just in case. And most of the time, they don't really know what's inside the tablet. So in this video, let's slow down for a few minutes and understand the basics of pain and fever medicines, so you know what you're actually putting in your body. I'm Ammar, a licensed pharmacist, and this is Medicine Wise, where we make everyday medicines clear and simple. If you like understanding your tablets instead of just trusting Google and WhatsApp, hit subscribe and let's start. First, a quick note. I'll talk in general, not about specific brand names. Names and doses change from country to country. Always follow your own leaflet and your own doctor or pharmacist. This is education, not personal medical advice. Now, when you stand in front of the pharmacy shelf for pain and fever, there are usually two main heroes, paracetamol and a group of medicines we call NSAIDs, like ibuprofen and similar drugs. Let's start with paracetamol. Paracetamol is often the first choice for simple fever and mild to moderate pain, like headache, flu aches, mild toothache, or after a vaccine. It's gentle on the stomach compared to many other painkillers, and when used at the right dose, it's usually very safe. But here's the important part. There is always a maximum daily dose. Above that, paracetamol can quietly damage your liver. You might not feel it immediately, but the liver takes the hit in the background. The big mistake people make is this. They take a paracetamol tablet, then they also drink a cold and flu sachet that already contains paracetamol, then maybe a combined painkiller that also has paracetamol inside. Each one looks harmless, but the total dose in 24 hours can cross the safe limit. So rule number 1, always count how many different products you're taking that contain paracetamol. Even if the brand names are different, your liver doesn't care. It only cares about the total milligrams. Now let's talk about NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen and its cousins. These medicines are great for pain with inflammation, joint pain, period pain, muscle strains, dental pain, and sometimes headache. They reduce pain, fever, and inflammation together. But every benefit has a cost. NSAIDs can irritate the stomach lining, increase the risk of ulcers and bleeding in some people, and they can put extra stress on the kidneys. In some patients, they can also raise blood pressure or worsen heart and circulation problems. So who should be extra careful? People with a history of stomach ulcers or bleeding, people with kidney problems, people with serious heart disease, uncontrolled blood pressure, or who are on blood thinners. Pregnant women, especially later in pregnancy. If you are in any of these groups, don't just grab an NSAID because your friend said this one is stronger. Stronger effect also means stronger risk for the wrong person. Also, NSAIDs should almost always be taken with food or a snack, not on a completely empty stomach, to reduce irritation. Now, what about taking paracetamol and an NSAID together? In some situations, doctors do use them in combination for short periods. For example, bad dental pain or high fever that is not coming down. But for the general public, the rule is don't build your own cocktail at home. If you really feel that one tablet is not enough, talk to a professional instead of stacking medicines on your own. Let's talk about a few common real-life mistakes I see as a pharmacist. Number 1, using painkillers as a daily lifestyle. Some people take 2 or 3 pain tablets almost every day for months. For headache, for backache, for stress, for just in case. Painkillers were never designed to be a daily vitamin. If you need them that often, there is a deeper problem that needs attention: posture, migraine, hormonal issues, stress, anything. Repeating tablets every day is like putting tape over a warning light in your car. Number 2, mixing alcohol with painkillers. Alcohol plus paracetamol puts extra load on the liver. Alcohol plus NSAIDs can be a bad recipe for the stomach and for bleeding. It's not a smart combo. Number 3, using adult logic on children. Their doses are based on weight, not on guesswork. Never cut an adult tablet into random tiny pieces and hope it's okay for a child. Use proper pediatric formulations and syringes, and always check the dose by weight. Now, some red flag situations where pain and fever medicines are not the solution. They are only a temporary bandage, at most. If pain is sudden, very intense, and worst ever in my life. If there is chest pain, shortness of breath, or pain going to the jaw or arm, If fever is very high and not improving at all, or lasts many days. If there is confusion, stiff neck, severe headache with visual changes. If pain is always in the same place and getting worse over time. In those cases, please don't keep upgrading from mild painkiller to strong painkiller. The problem needs to be diagnosed, not just muted. So, to summarize your smart patient rules for pain and fever, use paracetamol first for simple fever and mild pain, but respect the maximum daily dose, especially if you're taking multiple products. Use NSAIDs carefully, preferably with food, and be extra cautious if you have stomach, kidney, heart, or blood pressure issues, or if you're pregnant. Don't mix and match painkillers blindly. Don't make them a daily habit, and don't play dosing games in children. And if your body is sending very loud or very persistent pain signals, listen to it. Tablets are not a replacement for proper diagnosis. If this helped you understand your pain and fever tablets better, subscribe to Medicine Wise by Ammar for more clear explanations on everyday medicines and how to use them safely. For more clear medicine and nutrition tips, subscribe to Medicine Wise by Ammar. This is general education only. Always consult your own doctor or dietitian before changing your diet or medicines.